My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have CEO and co-founder of Uptiv Health, Torben Nielsen. Torben, welcome to the podcast.
Thanks, Norm, and it's great to be here. Look forward to this conversation.
All right. Well, thank you for joining the Digital Health Heavyweights. And for all of our viewers and listeners that are not as familiar with Torben, Torben is CEO and co-founder of Uptiv Health, a tech-enabled infusion center that offers virtual chronic disease services. Torben has over 20 years of business experience. He has worked with brands including Lego, Xerox, Blue Cross Blue Shield. Recently, he led the expansion of Zoom Care, transforming into the largest primary and urgent care provider in the Pacific Northwest, serving over 350,000 patients annually across 60 plus clinics. In addition, his contributions earned him Executive of the Year by the Portland Business Journal in 2021. Torben also co-founded HealthSparq, which became the second fastest growing digital health company in the United States in 2016 before being acquired by Kyruus in 2021. His work has been highlighted in studies by Forrester Research and PwC, and he contributed to Kevin Perot's 2021 book, It Takes a Village. Also an MBA graduate of Oregon State University, Torben is influential as a speaker in the healthcare industry, also a principal advisor at Blue Dot, as well as an advisor at HGAN, the Health Growth Advisory Network, led by our friends Michael Lacour and Josh Riff and Hassan Azar. So we're thrilled to have Torben on the pod and can't wait to jump in and learn a ton from you. So, Torben, let me ask you this. What inspired you to join the healthcare industry after coming from companies like Lego and Xerox?
I think it's a great question. In some ways, I think healthcare found me. As you mentioned, I worked for Lego, I worked for Xerox. This is back in 2000, 1999, 2000, 2001. The internet is just starting to, get off its, big boom. I've been working on some of the websites. I've been working on some of the e-commerce sites of Lego and Xerox, and Cambia Health Solution, a local payer here in the Northwest, had decided that it's time for us to really rethink how we cater to the members that we serve. And we think this internet thing is going to be big, so we want to hire some people from the outside to come in and break some glass and see what we can do. And that's how I got introduced to healthcare.
You were right that the internet did get pretty big, so good foresight.
Yeah. Got big.
So let's start at HealthSparq. You co-founded the company in 2012, eventually getting acquired by Kyruus in 2021. What inspired you to found HealthSparq, and what was the light bulb moment for you?
Yeah, I think it was exactly the mindset of saying, how do we take some of the methodologies and some of the approaches that retail has been so good at doing in years and years, right? Getting very close to the consumer, understanding what the consumer wants, and even some of the latent needs. Retail is very good at, finding out and providing services and products to that consumer. And our mission at Cambia Health Solutions, when I got hired, was to do the exact same. How do we become more relevant for the member that we serve as a health plan? What additional services or products could we launch on the Cambia website and create a secure member website as well, where we could serve up additional information based on your particular data and your particular plan? And so we started as a group sitting down thinking, what are some of those needs that a member has? And one of the biggest that all members of a health plan will have at some point or at some point will be who is in network, right? What provider should I go see? And so we decided to take all the information that we had on the providers that Cambia had contracts with in our markets and digitize all that and put it up on the web and allow our members to actually search for providers and see pictures of their providers, and actually allow the providers to also fill in their care philosophy, to start filling out their pages of who they are, who they see, and what their care philosophy is. And that was really novel at the time, right? This is back in 2006, where we started saying, let's create this digitized provider directory and make it real interactive. And on top of that, we said, let's also allow our members to actually rate the providers as well, and for the providers to respond to those ratings. And while we added, maybe there's a way for us to introduce shopping for healthcare, which was new and novel at the time, where we say, we are sitting on all the contracts, right, as a payer. We know what it costs and we know what your benefit plan is. Maybe there's a way that we can provide you the out-of-pocket costs real time for what it's going to cost you to see Dr. A versus provider B, or hospital A versus hospital B, right? So really introducing all that and allowing the members to feel more in control of their healthcare journey and to empower them to make smarter healthcare decisions. That was why we started HealthSparq. We had proven it out with Cambia over the past couple of years. In 2012, I went to senior management and I said, give us a pot of money, because we think that we can take this entity out in a commercial setting and sell it to other health plans, across the nation. And fortunately for me, management was bold enough and said that, we will, provide funding for this, spin it off of Cambia and go make some hay out of it. And that's what we did.
That's incredible. I love it. And the fact that you were doing this in 2012 is awesome to hear, because transparency in healthcare is still sought after, even now in 2024, going into 2025. So you were certainly ahead of the curve. Walk us through the growth of the company from about 12 employees and 3 contracts in 2012 to over 200 employees and 70 contracts by the end of 2016. How did you achieve that explosive growth in only 4 years?
Yeah, we saw massive growth, and in part because there was a lot of focus on transparency even at that time. The Blue Cross Blue Shield Association had certain mandates that they wanted to instill with all the Blue Cross Blue Shield companies across the nation around provider reviews, around price transparency. And in many ways, we, dove right into those mandates and said, we actually have a solution that we have been operating for the Cambia 2 million lives over the past 5 years. We know they work. We are now spinning it off. We're moving it into the cloud. We're creating a software as a service solution. You can take this SaaS-based product, you can serve it up on your own member website as a payer, and you'll pay us a license fee. And that was the early beginnings of HealthSparq, right? And we grew, as you mentioned, really rapidly to the second fastest growing digital health company in 2016. We landed as number 196 on the Inc. 5000 list. And, over a 5-year period, we're able to sign 70 contracts plus with payers, all the way from, big nationals to very small regional health plans that wanted to provide some value-added services to their members and their member websites.
I do have to ask 2 questions, totally, kind of veering away from our talk track. Number 1, who was number 1 in 2016?
I actually forget.
All right, we'll do some research and we'll report back. And then second question, your dog's not the first one to make their presence known on one of our podcasts. We've had other dogs, chime in. What kind of dog do you have and how old?
Yeah, we have actually 2 dogs, 2 Labradoodles. One is 16 and the other one is 10.
Wow, they're advanced in their age. Love it.
Actually, it should be 6 and 16, right? There's 10 years in between them.
Very nice, very nice. I have a black lab myself, so I love the Labrador breed, no doubt. So, what's your philosophy when it comes to pivotal hires in the early stages of companies that you run?
Yeah. So I'm a big fan of Lencioni, and who wrote, the 16 traits of, strong team members. I think it was called Patrick Lencioni, right? And he's got, 3 big, traits that he's looking for, and that, I really made mine as I, embarked on this journey. You want to look for people that are humble, that are smart, and that are hungry. And if they have those three traits, they are almost certain to be really good team members. And it was very important for us, particularly as you scale so fast, that you want people that are hungry to make a difference, right?
Yep.
They're smart people and they are humble, right? They can't, sometimes resumes, look amazing. And when you start talking to the candidate, you realize that maybe they have a little bit of a chip on their shoulder, but the experience is really great. They would fit perfectly into, what you're looking for. But maybe from a cultural perspective, and particularly as you're growing fast as a startup where you have to take on different hats and team dynamics means so much in the early days because it's just you and a handful of other people. You
Uh-huh.
cannot have people with chips on their shoulders. We all have to be humble. We all have to realize that we are in this together, and
Yep.
we got to be hungry and smart.
So I think all of those things are incredibly important. And those are probably three of the most important things I look for, when not only recruiting people for my own team and, growing my business myself, but also as a result of recruiting in this industry and, recruiting hundreds, if not over 1,000 folks
Yeah,
over the last, handful of years, when it comes to attracting the top talent to the top companies. But I will say this, I will I guess I wouldn't say fully disagree with you because I think humble is super important. But
yeah,
I also would say in a very early stage company, you have
yeah.
to have a lot of self confidence because
Yes,
you're going to deal with a lot of rejection and you're going to be
yes,
told no and you're going to be told you're crazy and that
yes,
less than 1 out of 10 startups actually make it. So I think being humble externally is
yeah,
super important.
yeah,
But I would argue those same people need to be super self-confident
yes,
internally.
yeah,
How do you evaluate for both? Because I do think both
yeah,
are extremely important,
yeah,
especially in an early stage company. Because
yeah,
if you are either a founder and you do have a steep hill to climb, or you're the first operations leader or
yeah,
sales leader or marketing leader or product leader, you got to have a lot of confidence. Otherwise, you're going to be like, well, I can't do it alone. So I'm not a good fit for the job. How do you balance those two things?
right. That's part of that exercise of you, having some time to digest and present a business case or a certain problem that you've been faced as a candidate. And I think it really does show how good you are at thinking on your feet and in a confident manner, presenting a case, to an executive team that's hiring you and putting
Yeah.
you in a really, good spot, hopefully, as part of a startup and growing a team.
Yeah. Because, in an interview process, someone could hear what you said and say, oh, I want to come off incredibly humble. And then they interview and they don't take credit for anything they
Yeah,
accomplished.
yeah,
And then that's
yes,
not good
that's right.
either. So it's
Yeah,
always that delicate
yeah,
balance.
yeah,
You want humble without, indecisive or
yes,
unsure of oneself,
yes,
and you
yes,
want confidence without cockiness.
yes.
And I
That's
think
right.
if you can get, those couple things, then you found that unicorn, if they're hungry and if they're smart in
Yeah,
addition.
yeah,
So I wanted to, just dive a little deeper on that. How did the product evolve, over that 5 years, where there was so much growth? Was it the same product the whole time or was there some improvements made?
yeah. There were some improvements made. Obviously, we continued to look at what the market needed and where we could make some adjustments. When you sell into a payer, it's one step removed from accessing the actual member as a vendor. And so, one of the things that we started to hear was, well, sometimes the engagement on these digital solutions is not where we wanted it to be. And it can be a health solutions. We had the whole marketing, campaign and machine, under our, us or responsibilities as well.
Mhm.
But when you go sell as a vendor, sometimes it's hard. So we started creating marketing packages that the payers could buy from us as well, based on known marketing tactics that we knew would drive engagement. We also added a reward system to the software product itself, such that members would get rewarded for choosing lower cost providers with the same quality, or we would allow payers to set certain parameters. And if members chose to see a particular provider or hospital system based on those parameters, they would get rewarded. Building in a reward system into the product was really key. And then We also added a community feature to the product because when you become a health plan member, you're part of a community of often, thousands and millions of other lives, right? And you're all in the same journey managing your healthcare. And so having a community where you could share some of your learnings going through it as a patient, and maybe even share how you feel the payer is treating you as part of that journey inside this secure member website, we found was real beneficial for the payers as well as the members they serve.
You had a ton of success at your time, with HealthSparq. What were the biggest challenges you faced?
I think early on, one of the challenges was a lot of these big payers had their own development teams or own IT teams that thought price transparency is interesting. Provider directories we can manage ourselves and we can develop it ourselves, and we don't need an external partner to come in and do that for us. I think if you fast forward 10 years to today, I think everybody is realizing that no code or low code is actually the way to go. The AI and code development is happening so fast that now it's much more of a matter of how you set up your tech stack to be flexible enough to consume API driven or microservices or other low code, no code vendors that come in and help you augment the core business that you're working on. So I think it was a little bit of a challenge early on, convincing some of the payers that it actually makes sense to have a partner that does this for a living 100%, and that's utilizing the latest tech stack possible to serve up some of these tools, and you can focus on your core business, which is really providing insurance for members across their region.
And that was going on in 2012. 15 years later, 12, 13 years later, are health plans still thinking that way, that they should try to build things internally themselves? Or have now they kind of shifted towards, hey, like it's better to have economies of scale, us focus on our core business, and then, have vendors help us in areas that isn't necessarily what we do best?
Yeah, I think the latter, Norm. I think everybody is realizing, and back then even the cloud was new, relatively new in healthcare, right? 2012, the first thing that we did when we launched from Cambia, right, spun off from Cambia, was to put our entire solution in the cloud. And even, back then it was like, that's almost unheard of, right? But today, building that flexible tech stack, I think, is what payers realize. This is where they need to play. They obviously are still sitting on a ton of data. There's a lot of analysis they can do, and in order to really help the member and the system become more efficient. And I think that's where they're focusing these days.
Can you share with the listeners why Kyruus and HealthSparq were such a good match for each other, and why in 2021 it made sense to combine forces?
Yeah, I had left HealthSparq at that point, but Kyruus was really focusing on health systems and providing provider directories to hospital systems across the nation. HealthSparq was focusing on payers and providing, provider directories to payers, and obviously is utilizing a lot of the same data, and so it just made sense, at least for me at that point, sitting outside, for the two companies to combine.
Yeah. And from the outsider's perspective, I haven't personally worked with them in a long time, but some of my partners still work with Kyruus to this day. And it sounds like the company is doing really well, and, the combined entity is thriving. So, it's good to hear.
Yeah.
Afterwards, you joined Premera Blue Cross as the VP of Innovation and Strategic Investments. Walk us through your experience going from being a founder to, starting to move into investment and venture capital.
Yeah, it was really interesting because being a founder, you're an operator, right? And you're in the weeds and you are realizing how hard it is to actually stand up a business, right? Even though from the outside it looked like, HealthSparq was going off the chart. We had our days and our moments where it felt, this is going nowhere. I just want to curl up, on the floor in fetus position and, cry my eyes out, right?
Yeah.
So that happens. And so when you're sitting on the other side of the table, all of a sudden as as a venture, we were corporate venture capital. Right? All of a sudden, you have empathy for that startup sitting in front of you. You know what they're going through. And for me, it was really good to join a corporate venture side because it's what you would call patient capital. It's capital that's doesn't need a return or a exit within 3, 5, 6, 7 years, but one that is a little more patient, right? And where you could actually embed a lot of the startups into the Premera business, right? That was our thesis. We will invest and do direct investments in startups where we know we have a problem or we have a need, and we want to bring them in, and they can almost utilize Premera as a lab, and they will learn with us and we will learn with them and help them make success in the market and solve a particular business need or problem that we were facing.
Yeah, Premera is the largest health insurance plan in the Pacific Northwest, covering over 2.2 million members.
Mm-hmm.
Walk us through just some of the technology investments that you made during your time there.
Yeah, so there's a couple of companies that stand out. I think that we made some investments in that actually were very early on in their innings. One called Prealize. It's a company that was utilizing healthcare data to start predicting the care journey that a particular member is on and actually create red flags of members going in the wrong direction where there might be a major health event happening over the next 6 to 12 months unless there's intervention or that member gets redirected on the healthcare journey. That was even before AI was really coming about. But they were very early looking at how do we utilize all the data that a health plan is sitting on to start predicting and creating anticipatory to us as a payer to then reach out to the member and help them get back on track. Obviously, that would save the member from real significant deterioration of their health outcomes, and it would obviously save money for the system as well, as we got these members redirected, if you will. So Prealize was an early one. We also invested in Vim, which has been very successful since. This is in the very early days of Vim, where they were still focusing on patient engagement, and they worked with us and we worked with them to introduce certain tools in the Premera app that helped members get more engaged in the healthcare journey. Vim, I think, is still, and Oran is a good friend of mine, the CEO. They've now really focused on EHR and optimizing the usage of EHRs. They've been now, I think they're funded by Uptiv and Frisk Cressy and other highly esteemed VCs and been very successful. And I'm very proud of having been part of their journey very early on. Giving them a little push and allowing them to find their way.
That's great. What was it like vetting telehealth pilots with SiriusMD and 98.6 for your employees / members?
That's right. And Norm, I completely forgot about those two, but they also were very early, right? This is before COVID, right? COVID had not happened. Premera wanted to really lean into telehealth, and we felt from the innovation team, right? I was hired in to also build out this innovation platform, and we had heard from our members that there's a need for telehealth, and we believe that we can create some differentiation by offering telehealth. We talked to the market, and SiriusMD and 98.6, 98.6 was in Seattle, right? Those two, we felt, they're market leading entities. We want to pitch them against each other and actually see which one, works the best. It's sometimes hard to, understand who's the better choice here. And so we felt, let's just give both of them a, option. We divided up the member population a little bit. To be honest, I forget who won, but it was nice that we were able to kind of launch both and see the differences in how they were utilizing telehealth at the time.
That's great. Having had perspective on, working on the vendor side and starting a company, as well as, also see the perspective as a health plan, employee. How did this give you a more holistic view of our healthcare system?
How hard it is?
Yeah.
I mean, it's like
Not for the faint of heart.
Yeah, we all say we're in healthcare, right? And it's so interesting because if you're a provider, you see one snippet of healthcare. If you're a payer, you see another snippet. And if you're a vendor or a partner, you see a totally different. What I found is that it's not because we're all ignorant or naive, thinking the world is all
Yeah.
revolving around us, but it really is because of the complexities of healthcare. Unless you sit in the shoes of a provider or in the shoes of a payer or a vendor, it's very hard to imagine what they're going through on a daily basis. That I think is I've been on the payer side, I've been on the vendor, and now I'm on the provider side, and so it's just interesting to see the different perspectives from each one of these angles.
So after Primera, what inspired you to join Zoom Care as their CEO?
Yeah, so I was recruited in to.
Those pesky recruiters, man.
Yeah, I know. Yeah, it's a. I was lucky enough to be, Zoomcare had just been acquired by a health system called Peace Health.
Uh-huh.
I was hired into Peace Health to actually lead their innovation initiatives as senior vice president. And soon after, they asked me if I wanted to take on the role of CEO of Zoomcare, an outfit that they had just purchased. Zoomcare had about 35, 37 clinics at the time, primarily in Oregon and Washington. And they wanted to really boost and grow that clinic operations quite a bit. And over the next 2.5 year period, we stood up 25 plus new urgent care, primary care, specialty care clinics. We went into 2 new states, 4 new markets. We went through COVID at the same time, so completely pivoted the business from being an in-person clinic operator to all of a sudden a virtual care
Yeah.
operator providing consultations via video or text, and had been leaning into that direction when I started. And so we were ready for COVID when it happened and could actually fairly easily pivot completely from in person to virtual.
So that's a huge success, being able to do that. Kind of walk us through your challenges and learnings and, how to move a provider group from all in person to all virtual.
It took a lot of hard work. Zoomcare was always founded with technology in mind. It was a 16-year-old company when I joined, and so they had been building out their own tech stack. They had their own EMR. They had built out their own application layer as well, and so own appointment scheduling functionality, billing, and so for us to launch video consultation and text actually was almost straightforward because we had our own development team that could make it happen relatively easy. We worked very closely with the clinical teams across our footprint to really make sure that they could utilize the laptops all of a sudden to provide the care in a video consultation. Zoom Care had always been an Apple shop.
Yep.
A little different from many other health systems. It was one of uh, the key elements of the Zoom Care was to be a little different and to utilize best of the best technology. And Apple really provided that, and it allowed us to quickly move into a video consultation, paradigm. As soon as COVID started, to kind of reside, and people started getting back into the offices, and we started seeing a really nice mix then of in-person care and virtual care. And so we never gave up on the virtual care, and I think it continued to stay pretty strong. Although we did obviously see a massive decline from being virtual 100% to then opening up our doors again for in-person care, but the hybrid model, I'm a big believer of. I think some patients prefer virtual, some patients prefer in person. Sometimes it depends on the situation or where you are, and being able to provide both in a seamless manner and have care plans and care policies embracing both modules or channels, I think is absolutely key.
I don't want to take away from what you and your team accomplished. I'm sure if the company name was something completely different, company would have been very successful. But was it helpful that the company was named Zoom Care during COVID when like Zoom was one of the most like highly utilized products? And on the stock exchange, like the stock price was just up and to the right for many, many months. Did anyone confuse and be like, "Oh, is this like Zoom, the technology vendor that just like created a Zoom Care product?"
It may have helped us a tad. Okay,
Get a foot in
I'll
the
give you
door.
that. I'll give you that.
All right, fair enough. I had to ask. So at Redesign, you co-founded Uptiv Health. What inspired you to found Uptiv?
Yeah, so I think what really inspired me by Uptiv and why I joined the company was the mission of humanizing healthcare and do it in a hybrid manner. So Uptiv Health is transforming infusion care as we know it.
Hmm.
We use a heavy dose of technology and software development to provide additional services, wraparound services in a
Hmm.
virtual care setting. And then we obviously stand up, infusion centers. And what I learned at Zoom Care was really the clinic operations and having in-person care. And so we're taking the retail-based focus that we're seeing, in the market, the Zoom Care, provided, adopting that at Uptiv Health, and then adding the virtual care component on top of it, because the patients that we see are chronic patients. They come in and see us on a very regular basis. Every 3 or 4 months, they need their medications, right? It's the only way they can get their medications is intravenous. And so they come in and see us on a regular basis. And we think this gives us an opportunity to ask them what else is ailing them in their healthcare journey and add those additional services in a virtual care channel to really view that patient as a whole person patient going through a complex healthcare journey. And because of the relationship that we're building with them, the trust that they're building with them, we think there's an opportunity to really work with them on broader healthcare issues.
And walk us through why you felt it was crucial to actually own the clinic itself as opposed to partner with existing clinics.
Yeah, so we've taken a very human-centered design approach to everything that we do. And so even in the manner that we create our and design our clinics, we've taken a human-centered approach. So you will not find a reception counter in our clinics because we feel there's enough barriers in healthcare as is. I
Yeah.
don't need to create yet another one between me and my patient. So we took away all the reception counters in the clinics. They don't exist. We don't have any paper in our clinics. We don't have clipboards, right? Usually when you arrive in a
What about magazines to
what
read
about
while you're waiting?
magazines? We have no magazines because there's no wait.
There's no waiting.
There's no
Okay.
waiting. Yeah,
That's
it's
a
amazing.
nice perk.
Yes, it's a nice perk. Yeah. So we have choreographed the experience with our nurses so that when Norm arrives in the clinic, our nurses will greet you at the front door, Norm, and say, "Hey, Norm, it's great to meet you. Let me escort you into your private suite." We have private suites for the individual. We have private suite for families that are a little bigger with a couch and sometimes there's toys and a little more space. And then we do have a few chairs out in the open. We call it a community setting because particularly our 65 plus segment, the retirees, they almost see it as an outing because they come in on a regular basis. They start making friends. And so they would like to talk and socialize during the infusion. But for most of our patients, they're professionals. We have flat screen TV. We have Wi-Fi enabled services. They can work. They can see their favorite Hulu or Netflix series. They can take a nap. We have dimmed lights in the private suites, snacks, drinks. And so it's a very different experience than today, where most infusion happens in a hospital setting that's very cold, sterile, and not very personalized.
And I would say most, if not all, have significant wait times
They
attached.
do. I mean, let's just go through a hospital setting, right? It's hard to
Please.
find parking. It's hard to find the building where you're going to get the infusion. Once you get there, it may be on the third floor, right? You get up on the third floor and you enter the infusion setting, and it's a big open room where there are just chairs lined up. Maybe there's a little curtain in between, but there's absolutely no privacy. It's very noisy. Alarms are going off. Nurses are running around. If you're bringing friends or family or you have your kids with you because you're a working professional, where do you put them? We are solving for all of that by having retail-based clinics or centers right next to a Starbucks, right next to a Qdoba, in areas where people live and work. They park right outside, walk 5 meters, they're in our centers, they get the private suite, and it's a totally different experience.
That's
And
incredible.
best
Have
of
you
all, Norm, I would just say best of all, we do it for half the price of a hospital setting.
Yeah, can't beat that. That's fantastic. Walk us through, where geographically your center is located and why.
Yeah, so Uptiv Health we closed our seed round of financing. We closed that back in June of last year, June of 23, 7.5 mil from Redesign Health, as you mentioned, an investor in New York. We stood up our first center in Detroit, Michigan
Hmm.
in September of 23, so just a few months after we closed our seed round.
Hmm.
The second center we also opened up in Detroit, Michigan in April of this year. We are off to the races, seeing we are getting close to 1,000 appointments, over the past 12 months, and have built up a referring provider network of
Hmm.
specialists in the Detroit market of about 150 independent providers referring patients over to on a regular basis. And these are patients that suffer from MS, Crohn's and colitis, rheumatoid arthritis, some severe asthma allergy patients as well, some eye diseases now utilize infusion to cure eye diseases. So pipeline of infusion therapies coming in is ever growing. There's a lot of innovation happening in this space, and we believe that this retail-based hybrid model of providing care in centers as well as at home via virtual channels is a win-win, and one that will see a lot of growth over the years to come.
Yeah, I did a lot of research like on the market, that you and a couple other early
Yeah,
stage companies are building.
yeah,
And what shocked me was just how many different types of patients and disease states infusion is necessary for. It could be cancer treatments, it could
yes,
be chronic skin conditions and
yeah,
autoimmune diseases and
yeah,
everything
yeah,
in between.
yeah,
So it really is a lot more than, I think a lot of people hear infusion center and they think like dialysis, chemo, and
yes,
that's about
yeah,
it. And
yeah,
like
yeah,
there's so many
yeah,
other
yes,
applications
yeah,
to
yeah,
the technology
yeah,
of offering meds
yeah,
via IV as opposed to
yeah.
orally or.
Yeah, yeah, that's right, Norm, and that's exactly where I think healthcare needs to move. We need to be much more nimble and focus on certain disease populations and create some really quality targeted solutions for them in their healthcare journey. So utilizing technology and utilizing some of that data becomes absolutely key. Having a really small footprint, a light footprint, as opposed to big, massive hospital systems that cost a lot of dollars, I think is another real key, and it's what retail has been doing for years, right? And we are just now learning that in healthcare, and I think it's going to be a really exciting time, over the next 10, 20 years.
Saving 50% is huge because, like,
Yeah,
again, something I did
yeah,
learn during
yeah,
my
yeah,
research is there are certain patients in which the infusions can add up to hundreds of
yeah,
thousands, if not
yes,
over $1 million,
yeah,
for
yes,
some
that's right,
individual patients.
that's right.
So if you're able to get one, patient that costs over $1 million, like you're
Yeah,
saving 500K
yeah,
plus,
yeah,
for their employer, which is
yeah,
fantastic. But
yeah.
can you kind of also walk us through the improvement in clinical outcomes? Have you seen a correlation between a more comfortable,
Yeah. Yes.
easy to access
Yeah.
service as
Yeah.
opposed to the hospital one, like how
Yeah.
that's actually
Yeah.
improving clinical outcomes?
Yeah, there's no doubt it's improving clinical outcomes, Norm. When we're able to see a patient overnight, right? They don't have to wait 6 weeks in order to get into a hospital setting. Many hospitals are starting to feel capacity constrained for various reasons. For us to be able to see the patient right away, for the patient to be able to be in an environment that's almost a spa-like environment that's really conducive to their healthcare and their healthcare journey means more than you could think. We have patients say, I used to go to a hospital setting, it would take me 3 or 4 days until I really felt myself because of just the stressful environment it is getting infusion in an open space where alarms are going off and it's hard to focus. When you do it either in a center-based model like ours or at home where you feel comfortable and you feel at ease and you can just focus on your own health, it just helps you recuperate faster from your infusion and get back into what you were doing prior. So
Mhm.
there's no doubt we see 100% adherence to treatment plans as well,
That's
because of the
incredible.
flexibility, our flexible
You don't hear that
right?
statistic too often,
Yeah.
100%.
Yeah, but we open over the weekends. We open late nights. We are trying to fit into the patient's schedule versus the traditional system where often you have to fit in as a patient into the system schedule.
Until, yeah, to what the hospital can accommodate.
Yes, exactly. And that's where we as a healthcare system as a whole need to be more nimble and flexible and think more retail. And that's what we're trying to add to it. So I'll give you another example. All our patients have an app. All our patients utilize the app to schedule their visits, right? They also utilize it to fill out all the clipboards that you usually do, right? They take pictures of their insurance card. They can upload it as part of the app, so we never have to ask for the insurance card when they walk into
Yep.
the center, and they can prepare themselves for their visit, so they can let us know prior from home via the app. I would like coffee, tea, or soda with my infusion. I would like Doritos or snack with my infusion. I would like Netflix to be on the flat screen TV when I arrive. And by the way, I would like dimmed lights. And I'm bringing a friend, and my friend's name is Norm.
Mm-hmm.
We can then address you and your friend by first name. We can provide a very personalized experience. So when you arrive, all those preferences sit on a silver platter in your private suite. It doesn't get better than that.
Well, I have one request and ask. Serve something a little healthier than Doritos. But other than that, I think it sounds fantastic. I don't know how much, feeding them Doritos helps their long-term health outcomes, but at the very least, they're comfortable. I'm assuming you have a lot healthier snacks offered as well. I'm sure there's a lot of people watching and listening this that are like, "Oh, this sounds amazing because I need infusion." And yes, the current place I go is not nearly as appealing as one of your Uptiv locations, but they might not live in Detroit. Where are some of your next centers going to be
Yeah.
built, and what do
Yeah.
our listeners have to look forward to?
Yeah. So we have a net promoter score of 99. We would love to take this model out nationwide and say we can do this, for all infusion patients in the US. We are going to go to market for Series A in Q1 of next year, so just a few months from now. With that funding, we are going to stand up additional clinics, likely in Michigan, but then we're also going to look at other states.
Mm-hmm.
And we'll be embarking on a fairly aggressive growth trajectory given our Series A that we hope to close sometimes towards probably early Q2 of next year.
I do want to follow up back on something we were talking about a few minutes ago. How, we have to fit into a hospital's schedule,
Yeah.
and that's pretty common, regardless of what ails us.
Yeah.
That is very, very much the experience, like going in as a patient at a hospital.
Yeah.
It very much gives off the vibe that, like, our time is more valuable than your time. And,
Yeah.
like, that's
Yeah.
just not a great way to treat your
It is not.
customers
Definitely.
/ patients.
Yeah.
Do I respect that? I'm sure a lot of doctors have a very busy schedule, 100%. But, like, Torben, I see the pace at which you work. Seen
Yeah.
you in action. I've seen you at
Yeah.
conferences and
Yeah.
health, and
Yeah.
you don't have a
Yeah.
lot of time in the day just free, that
Yeah.
you can
Yeah.
just do whatever you
Yeah.
want. Same
Yeah.
as
Yeah.
myself. If
Yeah.
you're an
Yeah.
entrepreneur in healthcare, you're working hard. Like, it's not a low amount of hour a week,
Yeah.
type of responsibility and
Yeah.
job.
Yeah.
So, like, how do you feel your company is kind of at the forefront of, being that, I guess, innovator in that, like, you are treating your patients
Yeah.
with respect and respectful of their
Yeah.
time,
Yeah.
and how
Yeah.
much of
Yeah.
that, like, is part of how you run each clinic
Yeah.
in, hey, like,
Yeah.
speed from door
Yeah.
to door is actually part of our competitive
Yeah,
advantage.
it's very much a part of our DNA, and it's part of our mission to humanize healthcare for the infusion patient. We believe that part of realizing this vision and mission is to enable technology and allow technology to be much more utilized. We have a 90% adoption of our patient app. It's how patients communicate with us. They fire off a simple text message to the care team. We have a team-based provider model. So anybody on the provider side can answer a text message that comes into a one channel, right? So it never sits in a particular inbox or somebody's inbox. There are no bottlenecks. And so everything that we do, we try to say, how do we create less barriers, less friction for the patient, and allow them to be in control of their healthcare journey? They should feel that they are in control and know what next steps are, and they should be allowed to take the next step. So we don't have this quite yet, but as part of our Series A funding, we will start allowing our patients to set up their own and manage their own appointments to a much larger degree. Today, most infusion actually happens via, you have to pick up the phone and call. You don't do that with Uptiv, right? We have an app, you send off a text message, but allowing you as a patient to feel more in control is one of our North Stars of Uptiv Health.
I love that. Very, very good. Other than opening up more centers,
Yes.
across Michigan and the
Yes.
country, what else do you see in the next 5 years, of infusion care in the US? And, how is Uptiv going to be leading the way there?
Yeah, I think we're going to see a lot of AI being applied in infusion care as well. There's a lot of manual processes that happen as part of infusion, where we work with payers on prior auth processes, or we work on collecting patient files and getting the full view of the medical history of the patient. All that is going to be AI driven. We're talking to some vendors already, embedding their solutions into our overall roadmap, and I think it's going to change dramatically. I think our vision from Uptiv is to become a chronic condition care hub, utilizing a hybrid model where we have in-person, light retail-based centers, and we have virtual care on top of it. And that hybrid model is going to allow the patient to improve their health outcomes and allow us to reduce healthcare costs in the system.
All right. Well, I've studied direct contracting ad nauseum, and I've talked about it a lot on this podcast. So, the viewers and listeners that watch weekly, this isn't going to be new to them. So a lot of people would ask, well, how are you getting 50% cost savings? Like, how is that possible? I know that part of it is through direct contracting, allowing employers and the providers to contract directly and creating a carve out network out of the carrier network is how you achieve some of those savings, just because I've studied it in other markets, whether it be the fertility market, like Progeny, or the bundled payment centers of excellence, surgery model, like a Carum, or radiology and One Imaging. So we've seen it in other markets, and now infusion's just like the next market that's being disrupted with this type of model. Can you walk through just how you achieve those savings outside of just that direct contracting piece?
Yeah, I think, when you compare us to a hospital system, they charge facility fees, and they have a lot of overhead they need to charge for as well, because they run, massive brick and mortar facilities. We lease, small little, retail-based centers.
And they have to pay receptionists and the front desk, and you don't even have them.
There's a lot of overhead costs that we don't have. That simply allows us to offer our services at a lower cost. I think over time, Norm, we're going to see, hopefully, I think, a desire to move maybe into more value-based arrangements, even on the infusion side, where we as a provider will manage that autoimmune disease population more closely, and we'll partner with payers around new payment models that could be intriguing, I think, as we get closer to our vision of providing these chronic care hubs in the markets.
Well, that's fantastic. It will already be launched by the time we post this one, but we're actually building a video series of us cooking healthier recipes as a team here at DRI on the digital health team. And I have my team rate the recipe and how it tastes to see if someone else might want to try it. So I have to ask now, are there any recipes that you would suggest we make on our recipe series that, can keep us healthy and might be something other people want to try?
Yeah, my girls, I have 3 daughters. They are 19 and 21, twins that are 21. They are inspiring me in terms of eating healthy. A few of them have been vegans, for a little while. Now they're vegetarians, but but they have introduced recipes into our family household that otherwise we would never have thought of. And so I'll go back and take a top 5, Norm, and I'll send it over to you.
Send it over. We'll make
yeah.
multiple on our video series, and we'll give you the credit. Your daughter's the credit, and I hope to do you proud and hopefully get rankings at least 8 out of 10 or above. But if not, I'm sure it has nothing to do with the recipe and more to do with my, cooking skills or lack thereof. So again, thank you so much for joining us on the Digital Health Heavyweights podcast, and really excited to see you and Uptiv's growth over the coming years, and can't wait to hear about all the success. So thank you, Torben.
Thank you, Norm.
Appreciate
really appreciate it. Yeah.
All right. Take care.
Yeah, you too. Okay, bye.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.